To establish a quorum, I'll call out board members as I see you. Let me know if I missed anyone. I see Dr. Kent, Dr. Makasokini, Mr. John Latch, Ms. Tanso, Dr. Asadi. Am I missing anyone? Okay. Anyone missing? Okay. At this point, I will call on other present to please briefly introduce yourselves.
Jennifer Green, Health Department Director.
This is Ashley Curtis, Deputy Health Director.
This is Lori Hagler, Medical Director. Good evening.
Andy York, Accountant.
Crystal Vincent, Director of Nursing.
Thank you. Anyone else?
This is Alba Natali, STI Epiclinic nursing.
Anyone else? Thank you. Can we take a minute silence, please, to unwind and bring awareness to the present?
Hello.
Thank you. Okay. Please take a look at the agenda for today. May I have the first motion to approve, please?
Motion to approve.
Second.
All in favor?
Aye.
Aye.
Thank you. I believe we all had the opportunity to go through the last minute meeting from April 20, 2021 on pages 2 through 5. Do I have a motion to approve, please?
Move to approve.
Thank you, Ms. Council. Second?
I second motion to approve.
Thank you. All in favor?
Aye.
Aye.
Thank you. Moving on to item 3 on the agenda. The floor is open for public comment, please. Okay. So we don't have any public member present. We will close the floor for public comments and call on Mrs. Tandy York to please present the financial reports on pages 6 through 11. Mrs. Tandy York.
Good evening.
Good evening.
No.
Yes, attached, I'm beginning on page 6. You have the financial reports for the month ending April 30th, 2021. First report is the statement of revenues and expenditures. At the close of the month, our revenues exceeded our expenditures by $557,966.82. Page 7 represents the expenditures by program. And I'll be happy to answer any questions you have as we go along. On page 8 begins the revenue report, representing the state and federal allocations we received through April 30th, 2020, along with the grants listed at the bottom of the page. On page 9 begins Medicaid collections, followed by fees. And then, of course, followed by the fund balance and county funds that have been allocated through April 30th, 2021 as well. On page 10 is our accounts receivable report by payer source, broken down by program, representing percentage at the bottom of the page. And then finally on page 11 is the agent report for our private pay, self-pay patients, broken down by program, and then the agent. And I'll answer any questions you may have.
Any questions, comments for Mrs. York on the financial reports, please? If no questions or comments, thank you, Mrs. York.
Thank you.
We will now call on Ms. Alba Natalie to please present the communicable disease annual report. Mrs. Alba, Ms. Alba.
If I could tee her up just for a second, Dr. Ojo. This is the report that's required for accreditation. And one of our accreditation requirements is for us to report back to the Board of Health on a yearly basis about our communicable diseases. Thank you.
Good evening. On that note, you can flip forward. Next slide. Okay, so we covered that. So today we'll just briefly go over some of the communicable disease data that I've compiled for you. Just some select communicable diseases. We won't go over all of them. The most recent available county data available is for 2019 on NCDHHS. All the data that you will see here mostly is compiled by myself from our North Carolina electronic disease surveillance system. We're hoping that the NCD3 dashboard will get updated soon to reflect current data. Full reports can be seen at ncdhhs.gov. As you can see here, in the last few years, from 2014 to 2019, there was a trending upward of STIs and other communicable diseases in Cumberland County. In 2020, we did see a little dip, but we do have to remember that in 2020, because of the pandemic, those numbers might not reflect accurately what was going on in Cumberland County. The data for the city cases reflect all STIs, foodborne, vector-borne, and a few other select diseases. Fayetteville right now is ranking inside the top 15 U.S. cities for STIs, with number 12 out of the top 100 cities. That's in city metro areas with an estimated population of 150,000 or more. Overall, North Carolina is 6th in the nation for chlamydia and 8th in the nation for gonorrhea. So that's something that we really have to keep track of. Next slide. So the three most common STIs that we're seeing in Cumberland County are chlamydia, gonorrhea, and NGU. NGU is usually caused by chlamydia in males. Into the mic, just a little bit. Yes. African American women and Latinx females have the highest incidence rates of chlamydia, especially those between the ages of 15 to 24. We also did see a rise in disseminated gonococcal infection in North Carolina. This is where gonorrhea enters the bloodstream and causes severe disease. So between January 2002 and December 2020, there was a 173% increase in disseminated gonorrhea. So in 2019, there were 22 cases. We haven't seen any here in Cumberland County that I have been reported, but we're keeping track of that. Next slide, please. HIV/AIDS. The number of people diagnosed with HIV residing in Cumberland County in 2019. HIV is 884, while AIDS is 160. HIV is most often diagnosed here in Cumberland County in youth ages 13 and 24, as well as our MSM population of men who seek with men. Cumberland County ranks 6th in North Carolina for newly diagnosed AIDS cases and shift for HIV in 2019. Again, 2020 data is not available as of yet. Next slide. For syphilis, we have broken it down by all stages. Syphilis continues to increase in women in ages 14 to 44. We see the highest rates among African American males in the MSM population as well. I used the U.S. Census Bureau data to compile the incidence rates for you there. Cumberland County is one of the 13 counties in North Carolina with the highest incidence rates. Hepatitis B and C. As you can see, chronic C hepatitis is really prevalent here in Cumberland County. Hepatitis B is vaccine preventable. We've only had 1 case or 3 cases in 2019. In 2019, there were 1,189 people living with chronic Hep B in Cumberland County, while there were 1,523 people living with chronic Hep C. Hep C occurs mostly in those 25 and 39 here in Cumberland County through IV drug use and sexual contact. Hep B often by IV drug use and sexual contact as well. Poverty is the highest driver of hepatitis B and C here in Cumberland County. It's usually reflected on those who live 40 to 50% below the poverty line here in Cumberland County. So these are some of the select communicable diseases. We have some foodborne, vector-borne Lyme disease, Rocky Mountain spotted fever. CRE and Strep A are two new diseases that we're keeping track of. Those usually occur, we see mostly in hospital settings. We did have 2 confirmed cases of typhoid in 2019, just to bring that out there. Next slide. The influenza activity here in North Carolina remained low this year. In 2019 and 2020, the flu-related deaths were at 189. In 2020 to 2021, there were 7 deaths. The flu season was around September 2020 to May 2021. We did have Ebola updates. We have 2 travelers who were notified by state that they were in an area where there was an outbreak, an Ebola outbreak. After investigation, those 2 travelers were not noted to be actually in the areas, so they were monitored for 21 days and they're all clear. We didn't have any cases of meningitis in 2019, but there was one early in 2020. TB highlights, tuberculosis remains pretty constant here in Cumberland County. We do have quite a bit of cases. In 2021 alone, we have 4 new cases. We do have 1 case that is of importance. This particular case has had 3 relapses in 3 years, and now the case is drug resistant, so we're monitoring that. We do have 3 health law violators that we're monitoring and working with diligently, and we had 1 death reported to us that was the TB diagnosis was made after the death here in 2021. Some of the barriers to quality patient care that we've seen here in Cumberland County at the SBI clinic and the Epi clinic. In 2020, we did have an azithromycin shortage, which is necessary to treat some of the STIs that we see, especially chlamydia, NTU, cervicitis, and gonorrhea. Although that did get resolved by December of 2020. We have an increase in multi-drug resistant gonorrhea. CDC has updated their treatment guidelines, so we are following that as well as guidelines from NCDHHS. Of course, the pandemic threw us for a loop. We did have to limit patient visits, but we did initiate telehealth visits. We did prioritize patients. And of course, we're thinking maybe the numbers are not reflective of those people who didn't come and get testing or treatment due to asymptomatic cases. Of course, as always, staffing remains an issue. We do have some shortages that we would like to hopefully fix one day, and funding as well. Moving forward, we do want to increase patient visits by 25% by the end of 2020 in the SDI clinic especially. We want to increase and improve community outreach. We are developing plans to, working with Dr. Green, to develop alternative outreach strategies for our vulnerable population. We are actively seeking grants from our partners so that we can receive the funds necessary to conduct this outreach. And we are waiting on that legislative priority, HB 61, so in that path. And that concludes the brief communicable disease. Any questions?
Thank you, Ms. Alba. Do you have any questions, comments on the communicable disease annual report? Comments, please. Thank you, Ms. Natalie.
I have 1 comment, Dr. Ojo. 1, thank you, Alba. Alba is our new communicable disease supervisor, and so she's been in her role not for very long, maybe 1 month, and so probably about week 1, I said, Alba, you're also going to go to the Board of Health next month and do this presentation, so be ready, and she was, so thank you. Alba mentioned House Bill 61 And that's the bill that we talked about at the last Board of Health meeting. That's the bill that would give some additional communicable disease funding. And so we want to get some feedback from the board about an opportunity to write a letter to our representatives. And if that's something the board is interested in, we can certainly draft that and have Dr. Ojo sign that.
Any comments on that? Any comments from board members, please? This is a very good idea, Dr. Bree, and I think we should go ahead and do that.
Okay, we will draft that for your signature.
Okay, thank you very much. Thank you. So moving on to the next item on the agenda, the state of North Carolina requires local health departments to conduct a community health assessment, CHA, every 4 years, as part of their consolidated contract and accreditation. So during the years in between such health assessments, the health department will submit an abbreviated state of the county health report. I will now call on Ms. Tamra Morris to please present year 2020 state of the county health report. Ms. Tamra, please.
Thank you. As you said, my name is Tamara Morris, and I am with the Health Education Division here at the Cumberland County Health Department. And I'm here to speak with you all about the State of the County Health Report. As mentioned, this report is state mandated, and our discussions are in alignment with accreditation benchmark 38.2. Our State of the County Health Report is on pages 17 through 21 of your packet. In 2020, the conduction of this report is how we share our progress on our community health improvement plans, any updates since our last community health assessment on morbidity and mortality changes throughout the community, as well as included this year, our COVID rates and vaccination data, social determinants and impacts from those on the community members are also included, and you'll see those demographics broken down throughout the report. This is a little bit different this year because our SOCH is based on our community health assessment, and we are now in alignment with Health E&C goals. So Health E&C aligned with the Affordable Care Act requirement for tax-exempt hospitals to assess the health needs of the community. And so because they were doing that every 3 years, we've aligned with this regional standard to make sure that we are conducting our community health assessment in a way that is not providing duplication of results. And so now that we're on the regional schedule, we'll be conducting our community health assessment every 3 years, and then our SOCH will follow along with that schedule as well. Our SOCH report has information about the coronavirus as of February of 2021. So the number of cases, number of positive cases, and the number of deaths you'll find on page 18. Those trends are broken down by gender, as well as the weekly cases are broken down by race and age. Again, this data is from February of 2021 and also indicates the number of vaccination doses that we have issued here in the county. Also, you'll find on page 20 information about the emerging issues since our last community health assessment. Again, as we changed to the Health E&C timeline, we were able to include their scorecard format with results-based accountability to align with the priorities and indicators, to also put those along with the Healthy 2030 goals. So those factors have been indicated here as well. The results for each category are displayed on page 20, where you can find information about how these factors are shown in social determinants of health. The only paused partnership that we've had since the beginning of the pandemic is our partnership with the Greater Cumberland County Sector workforce. We did have a monetary award from this group that was allowing us to have a workforce development plan This was put on pause as we have our response to increasing vaccinations throughout the community, as well as testing sites. And so our commitment to working through COVID-19 throughout the community has paused this partnership, but we do hope to pick that back up in the coming year. Our SOTS report is also used to highlight the progress that we've had on our priority health issues. And so these include access to health services, economy, to include employment, housing, food security, and living below poverty levels, exercise, weight and nutrition, public safety, and substance abuse. And so the SOTS is really just a snapshot of that progress. And so what you find in pages 17 through 21 is really just a snippet of how we've worked towards those goals and how those changes have made since our previous community health assessment. We're currently in the new regional trend year, so we're currently conducting the community health assessment. And so we are well on our way to our goal of collected surveys for this year. We should have everything in by the end of June, and then you should see the finalized community health assessment report at at the beginning of next year. Does anyone have any questions?
And I'll remind the board of a couple of things. One, if you'll recall a few meetings ago, we had updated you that there was going to be a pause in accreditation, meaning that we still had to meet all of our accreditation requirements, but they extended that deadline for one more year. So we got a conditional for all counties, 12-month extension on accreditation. So that also, we got some allowances to delay the trial just a little bit, but one of the requirements that remained in place was for us to do and continue and report out on our SOTS. So we've done that, but they allowed us to do a shortened version. So for folks and members of the public that are used to seeing a much longer SOTS document, this is the format and the requirement from the State Health Department for this year because of COVID. So just want to point that out for those that are remembering that you might have been used to maybe a 20-page document. This is the reason that we have a shorter version of it this year. We want it to be more concise and user-friendly.
Thank you, Dr. Green. Any questions coming from Ms. Morris? Thank you, Ms. Morris.
Thank you.
Next on the agenda is the location and the format for future meetings. So to board members, the question that came up is, when do we go back to in-person Board of Health meetings? Board members, we have two scenarios to choose from. We can meet here at the courthouse where we are right now in room 564, but only 7 people can sit socially distanced at the table. Others will have to sit in the chairs around the room, which is not a problem that I see. The same will also apply if we decide to return and meet as usual at the health department boardroom. 7 people can sit socially distanced at the table. The others will have to sit in chairs around the room. What do we think? Comments, please, from board members.
Can you hear me now? I'm sorry. Was that a question? Can you hear me?
Yes, I can hear you.
Okay, good. So I just have to ask, with the current mandate that came out from the governor, if our members are vaccinated and people are vaccinated, what do we really have to do that?
Yeah, so we talked to Dr. Ojo about this before the mandate came out on Friday, and so, or the new lifting of restrictions came out on Friday. So it's up to the board how you'd like to do that. The health department and the county for now, we're still keeping the mask mandate in place because we are a healthcare facility, of course. So we're keeping the mask mandate in place. But the distancing, you're right, Dr. Fleischman, that got lifted under the new executive order.
Okay, well, I guess, I guess we might want to dig down, maybe a small group and come back with a recommendation. I certainly think we should be in person going forward, and maybe people want a virtual option. I guess that's a possibility, but I think we should make an attempt to meet in person.
And I'm counting the chairs in this room. So for you, in person in this room with, without every other seat, there are 14. So we have space in 564, and I'm picturing the boardroom as the health department, and we have space as well around the table, of course, because we used to meet there in person as well. So we can accommodate both depending on what the board would like to do.
Actually, this room seems bigger than
Yes, this room that we're in right now, 564 at the courthouse, is bigger than the boardroom at the health department.
It's more spaced out.
And more space out.
It's entirely up to us. Do we want to come back?
I'm just one member. The other thing too is maybe after the guidance that came out Friday, y'all can revisit and see if there's any modifications to what we can do. But I still think if it is as is, I still think we should make an attempt to meet in person.
Anyone else? Any comments? Any questions?
I agree with Dr. Fleshman. We should meet in face to face if we can.
Dr. Makasokini? Dr. Asadi?
Would that option still be available to access through the GoToMeeting for anyone that is not comfortable meeting?
Yes, we can make the virtual option because likely we'll still have you may have a presenter that needs to present virtually, so we can keep the virtual option as well.
Okay.
Ms. Council? Do we have any other input?
Hello.
Yes, ma'am. What do you think?
Call me.
What do you think, ma'am?
Did someone call me?
Yes, ma'am. I said, do you have any comments, any questions for us?
Hello. Did you call me?
Yes, we can hear you.
Do you have any comments, any questions on that?
Me about the meeting places?
Yes, ma'am.
It occurs to me that we are ending this year, so it may be that we will be more comfortable, everyone will be more comfortable starting in the new year.
And
because we have one more meeting, that's June. Is that right, or have I gotten it mixed up again?
We go on the calendar year, but the county fiscal year does end in July or June 30th. So you're right. There's one more meeting for this year. There's no meeting in July, and then there'll be a meeting. We'll resume meeting in August.
But okay, I don't know. Maybe it's so much easier for me. This is easier. As long as we have the ability to call in if we need to.
Yes, we can keep that option.
Okay.
And I concur with Dr. Council that is my thought as well. As long as we have this option as a, another means to be a part of the meeting. How does that meeting, how would it look? What would be expected? Will everyone have a mask on? What does it look like? I heard you mention, Dr. Green, about the social distancing, the space. What's the expectation in reference to masks?
Right now, the county is still implementing the mask mandate. In particular, the health department remains a healthcare facility, so and that is still part of the executive order. But beyond just the health department, County Manager Amy Cannon has still implementing that mask mandate for us when we're in person, regardless of vaccination status at the moment.
And hi, good evening, this is Dwayne. I would also note that for the courthouse is still under a mask order from Superior Court Judge Jim Emmons. So I just want to add that for the courthouse.
Yeah, thank you for mentioning that, yes. So in either building, that mask mandate is in place.
So it might be simpler if we just wait a month.
So if I'm hearing you clearly, if we came, like you said, people would have to wear a mask for the meeting if we came in person. So I personally think that's fine. I understand that if it's a healthcare facility, that's what the court requires. I still think it's time to make an effort to meet. And with a virtual option, I'm supportive of that, but I think we should make an effort to meet if we can going forward.
Thank you. Any other questions? Any comments? So in summary, what I hear is we have the option of doing face-to-face live meeting, and then you can still continue to live stream. Is that right?
I like the idea of the hybrid option for a couple more months maybe, and kind of let things develop with the guidance and the adjustments, because it seems each organization is handling the guidance a little differently and trying to figure out how to make it work. So it seems like if we sort of graduate into this a little bit, that'll let some time go by for things to get refined with regards to what the norm is going to be.
Thank you, Mr. Latch. Thank you to all board members.
What I heard is we'll plan in June to have the virtual option, and then which you will still get that link from Kelly, and then we'll be in person in the courthouse in 564 for those that would like to join in person with masking in place.
Yes. Thank you. So we move on to the next item on the agenda. We have two items under the external reports: the North Carolina Immunization Quality Improvement for Providers and the Community-Based Care Management for High-Risk Pregnancies, CMHRP, Medicaid Transformation County Performance Assessment Reports, to be presented by the Health Department Director, Dr. Jennifer Green.
Good afternoon, everyone. So there are two external reports, and you'll recall that this is a tradition that was started under a practice that was started under Mr. Holder when he was the interim director to, in the interest of transparency, to share with the board and the public any external reports that we received. So the first one is a report on our Immunization Quality Improvement for Providers program. I'll note that this, the time frame for this was right in the middle of COVID. So the time frame for this report is from March 11th, almost to the day, 11th, 2020, to just a few weeks ago to May 3rd, 2021. And it is a report on our immunization practices to improve provider service delivery, and with the hope of increasing our vaccination uptake among children and adolescents. And we know that across the country, and certainly in North Carolina, we've seen a drop off in individuals that are getting their normal childhood vaccination. So these are the results for the health department. And you on page 2 of the report, you'll see our initial assessment in the green there, and our initial coverage rates, and then in the red box, you'll see the final coverage rates. And then in addition, you'll see the Healthy People 2020 goals in the blue boxes, and then along with some other national goals in blue. And then the first chart is the childhood vaccination summary, and then the second table is our adolescent vaccination summary. So you can see areas where that we are meeting either the state or the national metrics, and then a few areas where we have some work to do in getting our vaccinations increased. And of course, this notes that we are in the middle of COVID for most of this. So there are 2 strategies that we worked on. One was to have our providers currently inactivating patients in our state registry that we don't see in our office, and that we enter all the client data when we need to. Our second strategy was to make sure that importantly, making sure that we're recommending all vaccines to individuals, adolescents, and children in the same day and the same way each time. So you can see the results of that practice of that immunization report here. And I will, Alba mentioned our application for some grants to do more outreach clinics, and that's one of the strategies here that we're also going to be working on. It's thinking about additional outreach efforts, including back to school immunization. So as we are winding down this school year, our team is already planning and thinking ahead for what back to school immunizations are going to look like this year, so that we can make sure that we really address those childhood immunization vaccinations and those adolescent vaccinations as well. We'll also note that twice, I think, in the fall, there were extensions to the vaccination requirements for children entering school. So that extension ended in December, but that could also impact some of these rates, because some of those, with children being virtual and the pandemic, some of those extensions were in place in the fall. The second report that you have in your packet is from our CM Heart program, our care management for high-risk pregnancies. They recently did a performance assessment for each county to determine our readiness for Medicaid transformation. And as you know, Medicaid transformation, we're just a few weeks away, about a month and some change from when Medicaid transformation is going live. So there are a couple of benchmarks that I'll highlight here. There are 3 performance indicators that the reviewers were rating us on, and the first one is the length of time patients spent in non-active OB episode status, meaning the time that they're being referred, whether they're referred to a provider, they're pending, or actually engaged with the provider. The benchmark for this is we want that time to be less than 15 days, and our county's result was 5.8 days. So that we met that benchmark. The second benchmark is that we have all patient-centered interactions, and the benchmark was 85% or greater. And that means specifically that our case manager contacted with the patient via phone call or video conference, and our result was above the state indicator at 89.2. And then the last indicator was that patients that were in managed OB status during March 21 had a assigned care plan and an assigned OB engagement level and is receiving active care management with us. And the benchmark for this is 85%, and we were just under that benchmark at 74.4%. A couple of things that could have impacted that, of course, COVID. We switched to doing quite a few services virtually during COVID, meaning we would do that visit via telephone or phone, occasionally in person if it was necessary. But of course, in COVID, it's challenging to engage individuals. So if there are, I'll pause there to see if there are any questions about either one of those reports.
Thank you, Dr. Green. Any questions, comments, please, on those two reports? Thank you. Moving on to the next item on the agenda, I will call on Dr. Green again to please present Director's updates.
All right, I have a few updates for you. The first is about our community health assessment. As Tamara mentioned, we are part of the regional effort to do our community health assessment and in collaboration with Cape Fear Valley Health System. So as we noted in the last board meeting, we are now in the data collection phase for our survey, and we have it in English and in Spanish. That survey deadline is June 18th. And so far, we've collected 955 online surveys and approximately 200 paper surveys as of last week. So we still have another month to go before we close the survey. So that's really exciting. I think the region set a target for us around, I want to say 300, so we well exceeded that. And of course, we want to get above 1,000 surveys. So I anticipate that we'll be able to do that. Last week, we completed one focus group with college students. We plan to do these focus groups because we wanted some more nuanced information from individuals that are less likely to complete a survey. And so we did a focus group last week with college students. We had planned to do a focus group with some of our Spanish-speaking members of our community, specifically some of our farm workers. That got delayed due to the gas shortage, but we are, as that is lessening, we are actively working to get that rescheduled the next couple of weeks so that we can get that in-depth information from those that may speak Spanish. In addition, Fort Bragg has also completed or is completing their community health assessment survey. They just closed their survey last week, and they had 3,000 surveys completed. So, and we helped to push that survey using our social media. We had some funding that we could use to help boost that. And then also we handed out information at the vaccine site to get those distributed. So we'll be able to put their data together with our data to get some more in-depth picture about the health of our community. And as Tamara mentioned, we'll finish data collection here by the end of next month. And then we will work on the actual analyzing of the data and have the report ready. So we'll have additional updates for the board and opportunities for the public to engage. One of the things that we outlined in our strategic plan to the board was that we would provide updates on at least a quarterly basis about our progress on our strategic plan. So we started the strategic planning process more than a year ago, and the board approved that strategic plan. So we want to give an update on this initial process that we have been making. Our public-facing strategic planning report, and we're making final edits with our PIO department this week, and we'll have that public-facing document for the public very soon. The first internal priority the board set was to increase staff recruitment and retention and around employee satisfaction and improving morale. So we implemented a performance management system that went live in all of our programs and departments this year. So we were a little bit delayed due to COVID, just by a few weeks, but we got everybody live on our performance management system, and that's really the goal there, is to think about transparency and very clear metrics about how staff are performing. One of the practices that we're continuing to put in place is when we think about diversity and equity, or about removing those personal identifiers during the application process. All of our new supervisors are completing interviewing training with our HR department, with our HR liaison before they get into the interview process so that we make sure we have fair and transparent an interview process. And our employee learn system is also live. So by the end of the year, we want all of our employees to have at least one training completed and learn, and we've already accomplished that goal. So the next priority is on improving quality of services through our EHR. So as we mentioned during our last board meeting, we're working towards PRMD going live. You heard a little bit about, and we'll start that process in July. And hopefully we will have that implemented within a couple of months. You heard a little bit about Abo talking about opportunities to increase quality of services, and we applied for a Cumberland Community Foundation grant to address social determinants of health and address barriers to care. So we'll hear back about that next month. We also are preparing for NC Care 360 launch and making sure we're screening for all social determinants of health. I'm not the Medicaid transformation requirement, and we are finalizing that list based on the state guidance and getting all of our NC Care 360 champions ready. Another strategy that was under this category is InterGov, and we are set to go live in June and working on that online payment option for the public, specifically as it relates to environmental health. We also have a goal around medical records and getting those more in a timely manner. Our staff has completed training in NC DAVE, which is the state system that will help us to get to that goal. The next internal priority, the next internal priority is about outreach through social media. So we have a new PIO liaison who just started last Monday. So we're excited to partner with him. We've utilized grant funds from tobacco, opioid, and COVID-19 to do advertisements. And then the county, of course, is launching a new website that will, I believe, be launched later this summer. We also are working towards our partnerships under External Priority 1, specifically with academic, military, healthcare, faith-based organizations. We have done that, and we'll see in just a moment with our vaccination clinic, so we're very proud of that. And then also with our military health and readiness initiative. Actually, Ashley just did a presentation with Fort Bragg and the state this past weekend about some of our work with the military. In terms of mental health and substance abuse, again, we are going to address some of those issues with NC Care 360, and we are trying to help other mental health providers get onboarded, and specifically working with some of our mental health care providers through the Cumberland Crisis Collaborative meetings, and really trying to recruit them to be a part of NC Care 360. And then NC DHHS is hosting a tobacco webinar during the next couple of days as we think about menthol and tobacco sales and quitline during the pandemic and how we can engage public health, behavioral health professionals. And then these are two areas that we have not yet started a lot of work yet, but I just want to put on your radar that you'll be hearing more about that. Us improving health literacy, and then also some of those areas that we've already touched on, expanding community access to health department services. You've heard a lot about our plans for outreach clinics, and so that more information is forthcoming there. Okay, my last update is around COVID. So on the left, you have a picture of the county alert system. We still remain in the orange. We haven't yet moved to yellow. We were in yellow for a couple of weeks, and then we moved to, we're in the orange, which indicates substantial impact in our community. So we've had 29,000 cases. The good news is that we've had fewer cases in the most recent 7 days than we've had in the last 14 days, so 401 compared to 901. So that's an improvement certainly from when I was updating our slides in our last board meeting, so that's a good thing. Our case positivity rate has improved. We're at 6.9%, but we still want that to be lower. We're still higher than the state, and the state's somewhere in the 4 to 5% range, and that's where we would like to be, so we've got some work to do there. And then 304 members of our community have passed away. Testing, you can see week over week by testing. It's been pretty steady over the last couple of weeks. Testing, of course, is down statewide. You can see after the peak over the holiday season in January, December timeframe, we had a pretty significant drop off. But it's held pretty steady over the last couple of weeks. On the next slide, we have, I've shown you this slide before, but we're tracking vaccinations by age group and as well as our case count by age group to see really where we can make the most impact. So you've seen this slide before, and this just has updated data, really showing that our young people are accounting for most of our cases. We've really seen a drop off in cases among our older adults, which again is an indicator that our vaccines are working. We are really watching carefully how many of our young people are vaccinated. We know with the new group, I didn't anticipate that our vaccinations among 0 to 17-year-olds would be very high. And we've made some progress on our 18 to 24-year-olds. I think last month, we had about 9% of our 18 to 24-year-olds vaccinated, and we're up to 12.5. So that's the group that we're really trying to target, and along with this new group of young people. So our vaccination schedule, we continue to vaccinate on Tuesdays and Wednesdays at the Crown. We've got our outreach model on Fridays. And then I think on the next slide, I have one more slide. I'll talk about Bring Back Summer, and then I'll go to talk about our outreach clinic. So we are partnering with several agencies to get flyers and posters out around town about Bring Back Summer. We're working on digital ads and TV ads and radio interviews in English and in Spanish. So our outreach clinics, these are a couple of the places that we've been and are going. The new ones that we've added since our last meeting, Mission Field Ministries and Locks Creek Zion AME Church are new. We'll go to those places next week. We're excited. We're working with Capital Encore to do an outreach clinic there during Fourth Fridays downtown. So we'll do a late evening clinic there. We're still finalizing some details with them this week, but we're excited to have an opportunity to try to target some of our, work with the school to target some of our younger kids, but also being at Fourth Fridays and getting some of those 18 to 24-year-olds as well. And in terms of vaccination rates, we've got 24.6% of our population at least partially vaccinated with one dose. That's about 82,000 residents. 21.7% of our population is fully vaccinated. 2/3 of our vaccinations have gone to individuals, and by we, I mean the county, to females. A little bit more than a third have gone to individuals that are 65 and older. And then, of course, as always, our vaccination rates don't include numbers from the VA or Fort Bragg, so we fully expect that these numbers are an underestimate of the total number of people that are vaccinated. And that is, two more slides. This slide shows the demographic breakdown. The data hasn't changed much here. About a bit more than a third of our vaccinations have gone to those that are African American. A little bit of overrepresentation for those that are Asian and Pacific Islander on this slide, and then about right on par for American Indian and Alaskan Native. On the next slide, we can see the week-over-week data for those that identify as Hispanic, and so this is an area where we've really tried to do some work to increase those rates. So you can see that dark blue bar at the top is not quite where we want it to be, but we have seen some increases in rates among those that are identified as Hispanic, and about 6 or 7% of our 6.6% of our population that identifies as Hispanic of our vaccines have gone to those that identify as Hispanic. So I will pause there to see what questions the board.
I have a question, Dr. Green.
Yes, sir.
I was just wondering, has any data, I'm sure it's been gathered, have you seen any that has shown the effects of the vaccinations that have taken place so far? Have we seen a drop in the serious hospitalizations or the death rate?
Yes, so next time I will have a slide on our death data, but if you go back a couple slides to our cases, vaccinations among that slide, yeah. So vaccinations among young or older adults have always been low. They're at the green at the very, very bottom. And their cases among older adults have dropped off dramatically. We have seen very fewer cases among adults over the age of 65. Most of our deaths still occur among older adults, but we've seen a big drop off in the number of deaths. So, for example, since our last board meeting, we've had 6 deaths in our community in about a month. So, big progress there. And of course, most of those are older adults, but it feels for me, and the data shows us that those deaths are getting more and more spread out. So, certainly, improvement in the death rate. One of the data points that the state health department has pointed out to us over time is that we're seeing more young people get hospitalized nationwide and statewide, and more people that are more young people that are getting COVID because they're the group that's just not as vaccinated as our older adults are. And we hear a lot from young people, this isn't going to happen to me, but I was reviewing our death data today, and actually we've had 2 or 3 young people under the age of 30 pass away due to COVID. So it's certainly not the majority of our cases, but it certainly is not impossible and has happened in our own community.
Yeah, just to add that, Dr. Flashman, our census at the hospital is now running into the low 30s to low to mid 20s. It's kind of flattened out and hovering around there. And the age of the population that's being hospitalized is younger. And I would only tell you that that's only because all of the people that are over the age of 65 have gone out and gotten vaccinated. So I don't know if more young people are being hospitalized, or it's just a lack of all the older people that would be hospitalized, they'd be the same percentage that those people weren't vaccinated. So I think if you took the census we have now and multiplied it by 5 times, you'd probably be where we'd be, or 4 or 5 times we'd be if all the older populations had not gotten vaccinated, in my opinion. So, and you're correct. I mean, our ICU numbers are higher. It seems like it's a higher percentage of our census is now in the ICU, and I think it's a younger group of people. When I looked at our ICU census the other day, I think the oldest people in the ICU may have been in the lower 70s, but we had people in the 60s, 50s, 40s, and even 30s that were in our ICU now with COVID. So I think it's just, we need everybody to get vaccinated, but the people who are younger are still very vulnerable. We just don't know how to predict who those people are, except for what we've talked about before. So.
Thank you.
Any more comments, questions for Dr. Green? Thank you, Dr. Green. Please review the membership attendance roster and communicate any discrepancies to Ms. Kelly. Do we have comments, please, from board members? Comments, please, from board members?
Yes, there is one comment that is on the agenda, and I forgot to say it out loud. The Board of Health registration, not the local board health conference is August 1st through 3rd. If you're interested in that, please contact Kelly so we can get you registered.
From overwork. How many people have resigned?
Thank you, Dr. Green. If you are interested in NAVO conference, please contact Ms. Kelly. It promises to be very educative. Thank you. Thank you very much for attending today's meeting. Please mark your calendar for the next meeting on June 15th, 2021 at 6 p.m. And if there's any item or items that you would like to be included on the next agenda, please let us know ahead of time. Yeah, please have the motion to adjourn today's meeting.
Move to adjourn.
Second.
I second.
All in favor?
Aye.
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 Thank you very much and have a great week. Be safe.